common mistake I see people make while trying to learn to one arm is either a lack of a lateral tilt practice or the shite execution of them.
But before we go any further, we must understand the function of lateral tilting.
When you begin one arm work, your hand and shoulder must adjust to many new stresses and corrections.
But the most problematic of these is undoubtedly the lateral equation. By learning to tilt the pelvis to the side in a handstand, we can use the legs as counter levers to correct balancing errors that the hand and shoulder have missed. You could think of it similar as a stick to a tightrope walker. People often fall into one of two traps, and the first is treating the tilt as a mistake, which is technically true. But what this fails to recognize is the tilt acts as a safety net for inevitable errors that occur, as it's near impossible for adults to immediately develop the sensitivity in the hand and shoulder without some form of training wheels. The second mistake is declaring depth is best with little thought of how the spine should articulate the pelvis. Fixating on a low target usually creates a swinging rather than a tilt. A swing relocates the center of mass, which is fine when on two arms. But when attempting to use this as a corrective mechanism when on a one arm, this will pull you off your base of support and destroy the very thing it swore to protect. Instead, focus on keeping the center of mass for the better part localized while maximizing lateral flexion. It could almost be thought of as the beginnings of a Jefferson curl, laterally initiated leading from the tailbone with minimal weight shift. This action keeps the pelvis aligned inside the rib cage, reduces skeletal restrictions, and saves you a lot of energy. You can test the efficacy of your mechanics by filling from the ribs to the hands. If the movement is clean, you'll see almost no shift at all. So remember, tilting the pelvis and swinging the hips are two very separate actions with two very separate outcomes.